this is the long... Thank you for that. So this is the session we've been waiting for. It's communities engagement in the Global Fund Grant Cycle 7 processes. And this is the communities experience webinar. The theme for this conversation this afternoon is community engagement experience sharing. And so we are really excited as we look forward to hearing experience by communities in terms of participation in the Grant Cycle 7, the experiences, the processes, what are those things that stood out for you? And that is going to be very helpful in terms of moving forward with the changes that are needed and with our feedback, either to the country level or to the Global Fund Secretariat. Before we look into the objectives, which I believe you all have the agenda and the concept notes, but I'll first invite Tumaini Mbibo, who is the Executive Director of IANASO. IANASO is our convener this afternoon. Tumaini, wherever you are, kindly unmute and offer your welcome and opening remarks. And from Tumaini, I'm going to come to you, Felicita. So over to you, Tumaini.
Yeah, thank you so much, Rosemary. It's a pleasure being here and meeting new and old friends. It's nice to meet Felista again. I worked with the Felista at Arasa. So today we are meeting in a different forum. She's coming from Global Fund and I'm coming from IANASO. My name is Tumaini Mbibo. I'm working with the IANASO as a Chief Executive. And I'm here just to offer opening remarks. I participated in the G7 writing process, writing from the prioritization to the grant making. So I have a lot of experience and information to share, but today I'm not part of that. I know some people are here whom I know that will be sharing what exactly transpired at the experiences and what exactly we are expecting that maybe in future stakeholders and partners will be able to improve the way of doing things so that the community be at the center of what we are doing. We at IANASO, our slogan this year is putting the community at the center. So as you can see, partners and the stakeholders who have been joining this webinar to speak are coming from the communities. So what is going to transpire here is the voice of the communities. My call to speakers, don't speak on your perspective. Please put your shoes in, your feet in the shoes of the communities which you are representing, so that we can hear not the voice, not your voice, but the voices of the communities. For those who has, at the decision-making levels, to deliberate and come up with the decisions and plans that can benefit the communities. I welcome you all, and back to Rosemary, welcome on board and be free to speak as per guidance of the moderator. Thank you so much.
Thank you so much, Tumaini, and we thank IANASO for hosting the Learning Hub on the Community Engagement Strategic Initiative. We appreciate that leadership. It is very much needed in our region, and we see you and we appreciate you. So I'm going to move over to Felicita. Very nice to see you in this capacity. Felicita, to see you on the other side, and please feel at home, feel at home, feel at home. And for colleagues who might not know Felicita, of which I would doubt very much, Felicita is the technical advisor, the CRG Regional Investment Support within the Community Rights and Gender Department. But Felicita, feel free to introduce yourself so that we do justice to who you are representing here. So over to you for your welcome remarks.
Thank you very much, Rosemary and Tumaini. It's so British to be with you today. It's very strange not being on the civil society side of the conversation. But I was very excited to get the invitation to speak today, to do some welcoming remarks, but also to give some reflections at the end, because it's been very rare these days for me to be part of these types of, passion-filled, really grounded conversations about the experiences of community representatives, but also organizations that work to serve the needs of communities. So thank you very much to Yanaso and to you all for inviting me, but also for having me here today. As you mentioned, maybe just by way of introductions, I won't mention the new title, what, just to mention that until about 2 years ago, I was the director of the AIDS and Rights Alliance for Southern Africa, with whom I'd been for 13 years. So a lot of what we used to do and what I've done for more than 17 years of my career was really around supporting community engagement in national, regional, and international platforms and processes. And I always had an affinity for engagement in spaces where we were talking about money. And I used to find it so funny when people said, the British and other European countries, people are told when they grow up, they're talking about money is not a nice thing. It's not a polite thing to do. Because on the contrary, I enjoy talking about money, especially when it was money coming to communities, and really making sure that, we could bend the ears of those with influence to support the issues that were close to the causes and the priorities for communities, especially those communities that were on the margins of society, that were criminalized, who were deliberately being silenced. And so just to say that in terms of, the appreciation that I bring to the conversation around the role that everyone in this room plays to engage with Global Fund processes and to engage with other regional and international platforms and processes, not only those that work on funding, but those that set policy around HIV, TB, and malaria, and that influence the way that programming happens in our countries and in our communities. So just kudos to you, and please keep up the good work. I wanted to just put on my Global Fund hat quickly and speak a little bit about the commitment of the Global Fund to community engagement, which has been coming since the establishment of the Global Fund, and the Global Fund being one of the unique institutions, global health institutions, that in the partnership or in its partnership really centralizes the engagement of communities and the leadership of communities from the governance level down to in-country through the CCMs and other processes. So there are many things that we can criticize about the Global Fund, but really they are to be commended, or we are to be commended for the role that the Global Fund has played in strengthening the visibility and influence of communities in critical conversations, particularly those around financing for health. In the new strategy, there is a really centralizing of the community engagement by including a new objective on maximizing the engagement and leadership of communities most affected by HIV, TB, and malaria, to leave no one behind. This objective is operationalized in Grant Cycle 7 in several ways, which includes 3 minimum requirements for community engagement across the grant cycle. And my understanding is that the main one we'll talk about today is really around engagement with the funding request development and in terms of the processes that are related to the submission of the funding request. But also, I'm sure we'll touch on, during the grant making process and also during implementation, the extent to which communities have been engaged, because I think it's very difficult to separate those conversations because it's on a continuum of the process that this happens. So community engagement, is really key to what the Global Fund does.
Felicita, you've gone, so Felicita, your audio has gone very low for me. I don't know if it's the same for everyone. So Lizzie, may I check
Oh,
if it's
I can hear her loud and clear. She's okay. Yes, I can hear
Yeah, she's
her
loud and clear. She's very
Loud and
clear.
clear over here.
We can hear you, Felisa.
Thank you.
Rui, our translator's hand is up.
Okay,
Yes.
great.
Okay,
Great.
okay, I'm listening everything.
Good.
Rosemary, just let me know when I can continue.
Yes, please. I think we are good. It's just on my end. I'm gonna check what's happening for me. But I can hear you. It's just that it's soft. But
Okay.
happy that everyone else can. No, I can hear you very well. All
Oh,
right.
What
Great.
about Roy?
Yeah.
All right.
Okay.
Roy, is
It's
that good?
Okay.
In fact, I had to reduce the volume.
okay.
Oh, okay. All right. Perfect. Let's go.
Yeah, thanks.
Okay,
So just
okay.
to
I see two Rui. So Rui Semente and Rui and another Rui. Who Rui you are talking?
The trans interpreter, the one leading in simultaneous.
I am Rui Semente. I am Rui Semente.
All right. Okay. You can hear us very well. I think we are good. Yeah.
Yeah.
We are
Really.
all right. Let's go. Let's go.
Great. I mean, yeah, I'm really trying not to take a lot of the time because I would much rather hear what the representatives from the country processes have to say. So just wanted to illustrate a little bit the commitment of the Global Fund to community engagement in monetary terms through, one of the interventions that we have put in place along with supporting the regional hubs through the community engagement SI. And, when you talk about the Global Fund, you have to talk about money, which is something that I really do quite enjoy, especially money going to community engagement in communities to implement, and provide services. But in terms of monetary numbers, it's quite interesting to see the commitment of the Global Fund to community engagement, and to note that through the community engagement SI, of the technical assistance assignments that were supported, 55 of them, or the 41% of the technical assistance assignments focused on meaningful engagement of communities most affected by HIV, TB, or malaria in the GC7 funding request development. These assignments particularly supported communities to identify and align on priorities to inform the new funding priorities for civil society and communities annex. In addition, the community engagement SI also successfully leveraged its existing networks of key and vulnerable population partners to deploy a total of 1.2 million to provide US dollars to provide direct support for community engagement in GC7 processes in 57 countries. That's really, really impressive, and a core of what the community engagement SI has done for the last year or a year and a half around ensuring effective community engagement in GC7 processes and the development of those funding priorities annexes. The platforms have also, and regional hubs have also convened 7 regional GC7 readiness forums to ensure that communities were well informed about the new guidance and processes for GC7 and prepared them to engage in country dialogues and funding request developments. So that's just an illustration of how the Global Fund puts their money where the mouth is in terms of supporting community engagement, particularly now that it's so central to the new strategic plan. Once again, I thank you all for having me. I'm going to be very quiet and listen attentively, and then just come back maybe towards the end to share some of my thoughts, but very much looking forward to hearing and learning from you all today. Thank you for having me.
Thank you so much, Felicita. That's helpful in terms of highlighting the Global Fund investments through the community engagement strategic investment, and how also that support leveraged on the existing key and vulnerable populations in terms of resources and direct support to ensure that community priorities were organized, were included, were heard, and were presented, and all that. And I think that's why this conversation is important, because you have illuminated the resources. And so the conversation here this afternoon is, to what extent, was that helpful? To what extent did it give our communities a different experience, a better experience? And so we'll move forward to Glory. Glory will take us through the objectives very quickly, the questions that form our discussion today. And as I take to you, Glory, I also want to give a big shout out to Niluka. So I'm biased here because I'm excited about Niluka joining the other side, coming from, you know, GFAN, Global Fund Advocates Network, Asia Pacific, a colleague and a friend. So Niluka, I see you are here. We welcome you and we thank you for what you're gonna be doing on that side. So
Thanks, Rosemary.
yes, good to see your face. Awesome.
Well, thank you so much, Rosemary. Colleagues, good afternoon, good evening, depending on where you are calling from. Yes, I'm going just to give you the overall goal of this webinar, which is to enhance community engagement in future Global Fund processes, including the development of Global Fund country programs to ensure country TB, HIV, and malaria programs reflect the needs of communities in addressing challenges on the three epidemics. So that is the overall goal. We want to hear your experience so that it can inform future engagement. And we have specific objectives. We want to capture your successes. We want to capture the success stories in the processes, including what are the factors that led to those successes. We want also to capture gaps and challenges that communities experienced and that limited their meaningful engagement. Yes, in every success, sometimes there are challenges. So we want to capture that so that in future, we know how we can bridge those gaps. We also want to capture recommendations from communities. And this part is very, very key, very, very crucial. We want to hear if there were those challenges. We want to hear now, it's not only to speak about challenges, but we want to hear from you. What are your recommendations? Of course, colleagues from Global Fund are here, the one who are supporting us to engage. They will be listening directly from you. So this is space for you. Next slide, Richard. So our discussion today will focus on the key questions. We have 3 key questions based on the participant experience. What worked well during the GC7 processes that led to meaningful engagement, and what were the key gaps and challenges, and now the strategies and approaches to communities propose. So basically, we want to hear the entire processes, how you started to engage, how did you engage, like the entire processes, what made you to achieve, what made you to feel that, no, we were not that much engaged, and now what you are recommending. So colleagues, welcome so much. Feel free, share your experience so that we can, together, we can shape future engagement of communities in Global Fund processes. Back to you, Rosemary. Thank you.
Thank you so much, Glory, for setting us in the right direction in terms of the key founding questions. I see Peter Owiti and Vema. Is it something around logistics? What are you experiencing, Peter? I see you have your hand up.
Yeah, I thought you are opening the floor, but maybe I've walked into the floor too early. I can still go and sit.
All right, please keep it, and maybe you can type it so that we can first get the presentation, and then we open the floor, Peter, just in a bit. Let me invite colleagues here. We're gonna have reflections from 4 countries. And once we hear those reflections, the floor will be open. So we have Uganda, Kennedy, Otundo. So these are the colleagues who are going to share experiences. So we have an experience from Uganda. We have an experience from Ghana. So here we have Watara, Yahaya, please. Then we're going to hear from Zimbabwe, from Tariro, and South Sudan from Peter Garang. So these are colleagues who participated in the process, and are bringing us country reflections. What we asked them to reflect on is what Glory has mentioned, the best practices, the challenges, and the key recommendations. Let us start with Kennedy. Kennedy, over to you. You have
thank you.
8 minutes. If we can keep to that,
yes,
then we can hear reflections. Thank you.
I'm sure everyone is you're hearing me?
Loud and clear.
Perfect. This is Kennedy from Uganda, the executive director of UNASO, and which is related to INASO still. For those who don't know, UNASO is a Uganda network of 8 service organizations and is an umbrella in Uganda that is coordinating civil society, established in 1996. So far, over 375 civil society have subscribed with us. And our mission actually is to provide strategic support to 8 service organizations so that they can implement integrated sexual reproductive health and HIV program. And Uganda, so far, we were divided our region into 11, and we are in all those regions. And how we do our things through research, innovation, and management, knowledge management, coordination, capacity building. Of course, they have presented the overall goal of today's discussion, so I'll just go direct to the experience Uganda had actually. So in Uganda, actually, we had both positive and negative experience. First of all, I would like to say thank you to IANASO and those who funded us, actually the frontline and the team that funded us these funds. How the process started after we submitted our request for technical support, they managed to get us 2 people, one in country to give us a programmatic support, and then one from outside, that's Chris from Kenya, who gave us technical support on budgeting. We brought all the 14 constituency key population, that includes people living with disability, the sex workers, transgender, and all the type of the key population as you can mention. We brought them together, and the 2 technical people took them through using the models that Global Fund preferred to use in a in-house workshop and online. Also in some areas we did online, then prepared our friends to understand the models and the tools that are supposed to be used. Then some members were given assignment to do some bit of research to have better statistics that are related to whatever they want to present. Those of TB, we divide them TB, malaria, and HIV. So fellows were given assignment to do some bit of research. And what I saw, there was a national consultation. We did a national consultation, collecting information from all our region, those in Kampala and those up country. Those up country, actually, we use the Zoom, and those in Kampala, actually, we are able to use physical meeting. And some of the things we saw was there was a community consultation that brought all these people together, because in many cases they used not to consult the key population. As you know, there was that heat debate that the key population specific, this other of sexual minority, they were victim to in future, because the law was being prepared. But thanks to God, at that time there was not so much of pressure on us to discourage these fellows from attending the workshop. So we had a clean workshop where the facility fully said, one, there was a good national consultation. The fund helped us to do a national consultation. Then two, the technical people that were brought in, actually, they were very bright and managed to help us to understand the tools and the models that need to be used. And they gave us different examples from different countries, and we are able to understand exactly what exactly we can present, so that it can, when we present our proposal at the global fund level, it should not be rejected and be able to move very fast. Also, we had a team within us who are very good in advocacy. We had a consultative collaboration advocacy, especially we had Dr. Lydia, she's a good champion we had Flavia and the rest. They were very good, especially the women of 40. There's a movement called Women of 40. They were so good in advocating for the rights of the different constituency and the issues they really want to see coming out. And there are people also from the Fisher Folks community. They really wanted to see the Fisher Folks not be left behind. They really advocated for it. So there was that condition of key population constituency coming. And this is the external people. Then also the external people help us to align our objective with the Global Fund objective, because in many cases people bring issues, but they will tell us, no, this one will not go through. Make sure you stick around here, and this one help us so much. However, we had some bit of challenges. The challenges comes in a representation. You know, we were given a guidance just to have one person coming from each constituency, and sometimes it's not very easy to have only one person representing each constituency to reason across the 3 diseases. It wasn't very easy, but good enough. We had some members with experience across the 3 diseases that helped us, but it was a real challenge. And then during the writing, we were only given about 8 slots of members to participate, and it wasn't very easy, almost over 2 months. Unfortunately, we didn't have enough funds to feed our friends, transport them, but I really thank members volunteered. For the first time, I saw members volunteering, moving, and others walking direct from their home to Africana, sitting up to around midnight, putting in all whatever they could put. Either there is lunch, no transport, but they were dedicated. They were really fighters to make sure that the government does not win all the battles, and make sure that civil society also win part of the battle. And indeed, we saw most of our things taken in. And then also we had institutional barriers where government and civil society, in some areas they were not allowing the civil society to come in. Things looked creative, but the civil society had warriors that could sneak and find where they're located, which room are they located, what are they discussing. And good enough, we have phones, we could communicate using phones, have recall meeting, members strategize and move. Actually, we managed to push our agenda using all the thorax way. And while we are doing that, we were empowered by the external team that came from Nairobi, and our in-home technical person gave us all the insight, how to lobby, how to push the agenda. I think the funds that were given and technical input really showed us that we can challenge the government and force our agenda pushed in. So some of the factors that caused that is united advocacy and strategic partnership, because those who are good in TB were pushed in TB, go and represent TB. Those who are good in malaria. So we made sure that we divide our people based on their strength, based on their knowledge and experience, to make sure they sit and they coordinate. Where there's a challenge, we meet and discuss, we do feedback meeting, we consulted our technical people online, what do we do, and they give us support. So it was so good for us. What we are recommending here is that once we have this opportunity again in future, we need to have more funding, especially supporting our members to sit in the technical working group up to the end of the proposal, because the program was almost on daily, and it was expensive for our members to keep on traveling and attending. And remember, people were budgeted for food, were not all of them. So our members, some of them were not able to get the food from the side of the Global Fund team, but because they were volunteers, so they managed to look ways of surviving. But next time we need to have a team well supported in terms of transport, in terms of any logistics, like say meals and things like that, so that they don't leave any stone unturned. Then also another thing, we need to enhance what the structural reform, so that some of these things before that they reach, we should be able to sit with CCM, sit with the government and agree, so that we have an enabling environment for everyone, regardless of the law or whatever, to bring their view, so that we can enrich the write-up. I know right now we have a law that is against the anti-homosexual, but when we're generating something that is going to help the country in terms of disease control and so on, sometimes we need to forget some of these laws, and we bring these people together and we hear their views, so that we can have the content of what is causing the virus or what's causing a particular infection in the country, so we can able to come with proper strategy to address. And you can use an example of COVID. There was no discrimination during COVID, so everyone was brought on board. So when you are dealing with an epidemic like this one, sometimes some of the laws should be put aside so that you have everyone comes on board. We get the understanding on some of this epidemic and be able to put proper strategy to address it. Then I could just want to say thank you to the technical team that came from Kenya, and the technical team came from INASO and Uganda. Thank you so much. And actually, if you follow the story, you get that when our proposal was submitted, Beneva, I think we didn't have big hurdles. We were given a clear green light. Can you go ahead? I think the proposal is good. And almost for the first time, the proposal approved in the first round. That was really marvelous for Uganda. And actually, thank you, the members who gave us the technical input and the funds that came into the country. Thank you. So I think that's I can give. I know my friends are online who are on the front line. They'll also add in case this I've missed something. Back to you, Gloria.
Thank you. Thank you so much, Kennedy. Very lovely to hear experiences from Uganda in terms of the experience, the challenges, and some of the recommendations that you are putting forward. I would imagine that the experience is not different from other countries, but it's great that we have right now an opportunity to hear perspectives from other countries. So I'm going to invite Ghana, Watara. And as Ghana is coming, I had mentioned we will hear from Zim, we will hear from South Sudan, and we've grouped, once we hear from those four, we will then also hear from Mozambique. There's also Tanzania, there's Gambia. So we have a lineup of country experiences, and I am really excited about the kind of discussion we are going to have, generated from the reports that are coming from country level. So for colleagues who just joined us after we had done the introductions, this is the community's engagement in the Global Fund Grant Cycle 7. We are hearing communities' experiences from a best practice point of view, lessons learned, challenges, and also recommendations. And now we are inviting an experience sharing from Ghana, led by Watara. Over to you.
Thank you so much, Rosemary and team, and then a colleague from Uganda for such a wonderful presentation and great work that they did in the GC7. Currently, it's raining heavily in Ghana in my area, and then pardon me if the network isn't good. Then Candle alerts me if I'm not clear enough so that we can do this together. I'm Watara Yahya, the Executive Director for Network of Young Key Population. It's a youth-led organization working with adolescents and young people, both infected and affected with HIV, malaria, and tuberculosis. This was formed in Ghana in 2018 and then properly inaugurated in April 2021. We were established and saddled with a responsibility to facilitate provision of educational development, digital and social economic development, coupled with treatment, care, and support services to adolescents and young people population. All this with a vision to equip them with adequate capacity, skills, and information on HIV, tuberculosis, malaria, sexual reproductive health and rights services, so as to prevent further spread of HIV, tuberculosis, STI, and other health-related diseases among adolescents and young key population, and also the general population. I wouldn't want to talk much about that. We can read more about us. Let me go quickly for want of time. Speaking from a young person and then a youth perspective, and as a youth representative on the writing team in Ghana. Our engagement started when the Global Fund allocation letter came into the country. And as part of those requirements, you know that countries are supposed to have dialogues, not just dialogue, but an inclusive dialogue to ensure that no one is left behind. So as young people, we know how young people have been marginalized over the years in terms of Global Fund processes and engagements. For us to be able to maximize the opportunity, we thought and mobilized ourselves and said we have to make sure that we participate in almost all the country dialogue that is going to be organize and make sure that our priorities are reflected in all of these country dialogue. So fortunately for us, we were part of the Company in consortium that was led by Y Plus Global Youth Lead and then Youth Rise. And as part of the support, we were able to mobilize ourselves and engage ourselves and come out with our own priorities. And coupled with that, we did a rapid review of the NSP, that is our National Strategic Plan. The reason was that we wanted to identify areas where implementation was weak, and then areas that should be included in the next NSP. And then from that, this was also followed by the Global Fund GC7 community priorities, and then we did some of these civil society priorities, engagement, identification of priorities for young people. We review all the interventions that are available for young people, especially using the modular framework. We discuss it, and those discussions was based on the issues that we raised in the NSP review. And then we were able to put together all this and compile it based on what was urgent and what is not implemented in the current grant cycle, that is GC6. And then going forward, what was not implemented should be included. So we compile all these priorities and shared with the writing team, especially the consultant. I would want to tell you best practices or success, what went well for us. And I would be very glad to share that this was the first time ever that many of the the youth priorities that we came out with was included in the final funding request. And it was also the first time in Ghana that youth representation were actively participated on the workshop, and even within the writing team's workshop, we were able to review the funding request and make recommendations on those funding requests. And you could remember, I said this was the first time ever. So that needs to be celebrated as success for us as young people. And it's also the first time that we youth were able to review the NSP. And likely for us, the Minton NSP review came out of nowhere. And for it to coincide with the GC7, it was a great opportunity for us to review the NSP. And many of young people, to be frank, didn't even know about the NSP. Me speaking, didn't even know much about the NSP, because what was included, I was asking myself, how many young people were consulted to come out with this NSP and these priorities for young people? So it was an eye-opening to be able to go into the future that the next NSP should look like this, and this should be included from young people perspective. That is from our perspective. And it was also the first time that most of us participated in the HIV writing workshop. It was successful because we were able to advocate explicitly. We were naming things for young people. Before, it was just boxed in, or interventions were just boxed in together for everybody. But we make sure that we name it as young people's perspective. These are beneficiaries for several. These interventions are for young people. And we're working with the lead consultants and CCM members who were on the writing team to ensure that all interventions that we raised were tailored to young people specifically. Definitely, if we have success that had achieved without challenges, we will encounter a couple of challenges. And one of the challenges I would like to share is
Watara, you're on mute now. Please unmute. I think you went on mute.
so sorry. Where did I stop so that I could pick up from there? Rosemary, if you can assist me.
Yeah, you are talking. You had just finished the previous slide about young people participating in the writing workshop for the first time, and you are transitioning to the challenges.
Thank you so much. And I said for one to achieve success, definitely there's going to be a couple of challenges. So These are our successes, and one will ask, what are the challenges that we face to be able to achieve those successes? And I might say, first, which is a very big challenge for us, is that historically in Ghana, there has been very limited intervention for young people in the global farm processes in Ghana, and that is a fact. And the involvement of young key population or young and key and vulnerable population in the 3 previous NFM processes, that's the Global Fund Grant, the 3 previous Global Fund Grant cycle has been very minimal. And why I said this is because being involved in the Global Fund processes should not be limited to submitting of funding requests or seeing your priorities being reflected. After that, what happened? Had these priorities been handed over or be collaboratively with young people to ensure that these interventions are implemented to meet them in their different diversities? Mind you, he who wears the shoe know where the shoe pitches. Young people are capable of providing solutions to meet their own challenges. And if we are not included in all this, then it becomes very difficult for somebody to sit and provide solutions for a challenge that you are not facing by your own self. One of the biggest challenges, again, was ensuring that our voices and needs are respected throughout the processes, especially, let's say, at the CCM level. Processes negate our technical experts because young people are just invited to come and sit and take boxes, but our experts, our technical experts are not taken into consideration, and this negates our experts in our matters with respect to our expertise. Another challenge is that on the TB funding request, we did not have a youth that was represented on the TB writing funding request. There were people who were who represented in the TB funding request, but I thought we should have a young person affected by TB on the TB funding request to write or to also bring priorities from young people perspective and not elder people making intervention for young people. That is with regards to the TB side. And what we strongly recommend that in the future was that mechanisms should be put in place to ensure that we have a youth seat on the CCM. And I must say this, it has been a challenge, but then there have been some successes around it. Ghana CCM has not been able to accommodate young people on the CCM. Whatever challenge it has been in the past, we've been able to dialogue with the CCM members and the current CCM, and there has been some assurance that there is going to be a youth representative going forward in the CCM, and that is what we're looking forward to see, because we believe that if you are not on the table where decisions are taken, nobody speaks for you, and these are avenues where critical decisions are taking place. So if we have young people on that seat, we will be able to channel our voices and worries and issues to be addressed on this high tables. And I might also commend Global Fund for a technical assistance that was given to Hope for Future Generation, led by Madam Cecilia, who is a very great supporter of young people. And that technical assistance actually also helped us in terms of being on the writing team, because one will ask, who funded you to be on the writing team? Because all these writing workshops will demand resources. And who are those people? And that was when this TA from Global Fund with the consultant Leslie from South Africa, coupled with other young people like Priscilla, Anthony, and then Mavis. These are great young people that came together and supported the process to ensure that our voices are not left behind and are included in the funding request. But the one question that I keep asking as a young person is that Global Fund strategy, we are having the slogan. I was very happy to hear Executive Director of ENASO saying that this year ENASO focus is letting the community. It has become a slogan that ENASO is having, and I will encourage all other organizations, including in Ghana, to also adopt this slogan of ENASO by letting the community lead and letting community be on the forefront. But it shouldn't be a tokenism approach to letting community lead, but it should back by action to ensure that community are at the forefront on providing their own solutions to their own problems. Like I said earlier, he who wears the shoe know where the shoe pitches. When communities are being capacitated and capacities have been built to lead we lead interventions that are the true reflection of what is happening on the ground and not data backed by whatever way that data has been found. And we also strongly
Watara, I'm gonna cut you
advocate.
short. I'm
just gonna end by saying that we need TA for youth-led network and organization to cascade consultation when it comes to Global Fund grant in groups and locations that are hard to reach, because Global Fund has a principle of making sure that we reach the last mile. We cannot reach the last mile if organizations, young people are not empowered to lead grassroots change through TA and other ways that we can be reached. Thank you, and over.
Thank you so much. I can't find my clap, how I'm supposed to do my virtual clapping, but to you and to the Uganda presentation, really very much appreciate the passion. We can hear you. We really appreciate this. And there is so much that is coming out. There's so much richness. And already when you listen to the presentation, you can already see also how we can have like cross-learning. Like some of the challenges in Ghana, it seems like Uganda has overcome those. Some of the challenges in Uganda, it looks like Ghana has overcome. So I think also a meeting of the mind in terms of innovation. So I really appreciate what is coming out here. And to this slogan, let communities lead, I want to do a bit of a modification, because honestly, from the presentations from Kennedy and Ouattara, communities are lifting a lot. There is a lot of leadership. So perhaps it's about communities have been leading, fund communities to lead more, fund communities to lead better, support communities. So really want to appreciate and to applaud this leadership. We are going to go to the presentation from Zim, and I know Tariro will not be making the presentation. In her place, it's going to be Walter. So Walter, please, over to you. Kennedy and Ouattara have been very respective of time. So we are going to be really, really strict with time so we can finish in good time. So over to you, Walter.
Rosemary, let's go to South Sudan while we wait for Walter. He's not yet in the webinar. He's facing an internet challenge.
Oh, sorry, apologies for that. So let's go to you, Peter. Peter Garang from South Sudan. Introduce yourself and make your presentation, Peter. Over to you.
Thank you so much, Rosemary, and colleagues that are all here from the communities and civil society fraternity. My name is Peter Grant, and I will be sharing an experience on South Sudan community engagement experience related to GC7. I'm also glad to inform the fraternity that I'm currently supporting a country as the National HIV Prevention Consultant, which is something that is a thumb up to all of us, where we can push the agenda of inclusivity in HIV prevention programming. So this is what I'm currently working on, and I thought the House should actually be aware, supported by SARS to SARS Learning Network. So the presentation outline is going to focus on three things. Of course, it's experience sharing, key successes, challenges, and key recommendations. Next slide. Our engagement processes, as we are all aware that the GC7 started with the country review of the National Strategic Plan. And so our processes started having a critical engagement into HIV Strategic Plan revision and updating, where we actually ensured that for the first time, most of the community interventions were actually factored into the National Strategic Plan for South Sudan in the next 3 years. And we had an opportunity to source the technical assistance from UNASO that supported the CSOs and communities to meaningfully engage during the process. And when this TA support came in, we thought of dividing the country into groups. And South Sudan was divided into 3 regions because South Sudan is a country divided into 3 regions, where Bahar Ghazal, Upper Nile, and Equatorial region. So we had moved as from the national down to the people, where we conducted 3 regional consultation meetings and 1 inclusive consultation that was done at the level of Juba. And what happened was, because of the sensitivity of the KPs and because we had wanted the process to be inclusive, we had exclusive 3 KPs consultation meeting. That were provided. And that gave an opportunity for the communities from MSM, the communities of those who inject drugs, and communities of female sex workers to come together in their numbers to set their priorities. And that environment was actually provided by SAC. We actually ensured that there is a good relationship with the government entity, the South Sudan AIDS Commission. They ensured that the process of KP's consultation was done in a free environment. And just to tell you that during the process, we could even get security people coming into the meetings. But then with the presence of SACs, we were able to pull back those security people and then tell them, no, for now, we wanted, this group of people to freely discuss the issues that affect them. And you could see them going back. And much as there was suspicions why this group of people was wanted to, to sit alone, because the country context is that every meeting that happens, you must actually look for security clearance and give them the details why you are holding a meeting. And with the help of South Sudan AIDS Commission, we were able, to pass through all those without hindrance. We then had the identified priorities were consulted, of course, by the help of national consultant that was supported by UNASO, and 1 international consultant that was hired by UNAIDS. And the consolidated priorities were submitted to CCM for further consideration. We also given opportunities, support with consultant to cost our own priorities. This time, the civil society and communities were able to cost independently our own priorities. And what we did during writing process is that we divided ourselves. There were core teams that were established, fully supported with the TA support. They were given transport fund to be able to sit into the 3 diseases, of course, with disease expertise, and that is malaria, HIV, and TB. And there's some people also traveled to grant making, and we also continued up to the TRP related comments responses. Next slide. The next slide is talking about the successes and what were the key enablers. We had key 4 successes, one of which ensuring that the components or interventions that were related to communities were clearly articulated into the national strategic plan, and that gave us opportunity to take the same drive into the funding request. We also had an inclusive consultation process for priority identifications, and that include, for the first time, even including MSM group and those people that inject drugs. As a result of this, we were able to secure a funding of $4 million USD for community system strengthening, human rights, HIV prevention for key and vulnerable population, and community interventions that were under care and treatment. And this is the amount we had. And you could imagine, as a result of 25,000 that support that we got, we were able to budget our interventions to arrive into 4 million. So we could see the cost effectiveness of having everybody engaged into this. We had active participations of communities and CSOs in all GC7 processes, including TRP comments. We had 3 key enablers. One, CSOs were part of every processes, and that include NSP, and then took up the key secretariat roles during the revision of the NSP. We had the opportunity to have a conducive environment being provided by the South Sudan AIDS Commission, and of course, the TA support from UNASO. Next. 2 challenges we had. One was the limited timing, and that actually prevented us from including, communities at the prison setting. mergers, we had a plan for that, but because the time was so squeezed to conduct all those regional consultations and then national consultation, KP's consultation, we were not able to do that. And we also got another challenge during the negotiation process, grant making. And because as civil society, we don't have those, negotiation skills, most of our interventions were actually pushed by the strong negotiators from implementers and sub-recipients. And most of the interventions from the civil society and communities were actually pushed to PAR, above allocation during grant making, because we lack negotiation skills. Next, which is the final slide. The final slide is talking about the recommendations, and we had key 4 recommendations. One, we recommend that in the future, grant cycle, the TAs, all these communities and civil societies applying for TAs should do that as early as possible. And we also conduct trainings for communities and CSOs leaders on prioritization and then negotiation skills. And then this strategy, stay on the keyboard. We noticed that taking key roles in the secretariat, being part of the groups that is writing, being given tasks to also write is helping a lot, because that will help us and that will help our interventions not to be pushed back during the writing process. And the last one is make sure that we involve every person in the process. That is the end of my presentation. Thank you so much.
Thank you so much, Peter. We appreciate that. We clap for you virtually. Another excellent presentation from South Sudan in terms of community experiences in Grant Cycle 7. And we can see some thematic areas coming up. We can see some areas for learning coming up. Uganda was asking, how do you ensure that communities stay from the beginning of the process all the way to the end of the process? We heard from Uganda that it was a challenge for communities to be part of the process from the beginning all the way to the submission. We heard from Ghana, like in the TB funding request, no youth representation. Their desire is to have a young person represented in the TB funding request. How do you navigate that? How do you maybe work with the other community groups to ensure that there is a young perspective regarding the so a lot of lessons. South Sudan negotiation skills, Peter, it's coming up, and I like the sincerity of the conversation. Are there some countries where we have mastered how to negotiate? What are the tricks of this trade? So a lot of things that we can learn from one another. I don't want to undermine the discussion by summarizing. It's very rich. I just want to take us to the next presentation. So Ramon, we see you. We'll come to you. If it's not something around logistics and audio, if it's a question, I would say you pack it a bit so that we can hear from Zim. Glory, is Zim here?
He's in.
All right.
Thank you, Glory. I hope everybody can hear me.
Yes, you are loud and clear.
Thank you very much. Sorry again, took me a bit of time to connect. So I'm going to share the experience from Zimbabwe. If you can go to the next slide. Okay. So in this slide, I just gave a map of the activities that took place in terms of the roadmap of what we did from the beginning to the end. So you can go to the next slide so that I can now engage. So on the experiences, we are so excited that, as civil society, this time we had an opportunity to be involved in the midterm reviews of our critical documents, such as the Zimbabwe National Strategic HIV and AIDS Plan, and then also the TB and malaria strategy. So we got an opportunity to be involved most of civil society organizations were involved at regional and national level. However, we do have certain constituencies that did not take part in these discussions, which then became also a challenge for us and a concern. So from the review of the strategic documents, we then went into engaging the greater civil society for country dialogues. And I must say, it was quite interesting that this time, because of how we managed to resource mobilize, we actually had three streams of funding. We had direct funding that came, the usual funding that comes from CCM. Then we also had funding from constituencies. Different constituencies managed to get funding. Let me recognize CRG, who were very instrumental, also GIZ, and a number of UN agents, including UNAIDS, managed to come in and support. UNICEF came in, support the young people. But also interestingly was that the government of Zimbabwe, through National AIDS Council, managed to support key population members who are currently implementing Global Fund, Key Populations Grant. We had timeless communication from Global Fund. We're excited. Some of us who are part of the CCM were excited to receive communication early from Global Fund, and very clear with all the instructions, our letter, our allocation letter in time to give us enough time to prepare. We also got program essentials in time. So when we were now doing our country dialogues, we managed to then unpack some of these documents so that even those members who don't usually attend CCM were also able to interact with the documents, with the different documents. The coordination, we saw also very strong coordination coming from some of our networks, such as Zimbabwe AIDS Network, it's RNNP Plus, NANGO, National Association of Governmental Organizations. So we did have strong coordination, which we were lacking before in other rounds. In this particular round, in GC7, we managed to be able to secure, we managed to have strong coordination from our networks, which is something that is really commendable when we really want civil society to be actively involved in such activities. We managed to also have 12 constituencies represented. These constituencies that were represented during the dialogues, we then auto-rolled with the same constituencies to then do the priority settings. And this time, with the support from CRG, we managed to come up with a civil society priority charter, of which we engaged almost, in fact, all constituencies were engaged and reached out to. One of the sectors that was almost left out was the young people, but we're happy to say UNICEF then came to the rescue and they seconded some young people who then came and became part of the priority setting team. So during that time, when we were now doing the priority setting, we managed to then come up with a writing team. We agreed as civil society that we would have a writing team, which will then also have a backup team that won't necessarily be part of the writing, but they will be there to as a backup that can then provide necessary information when it's needed, documents, evidence for models that would have been included into the writing. So we managed to have two sets of teams that we were working with during writing. So after our priority settings, we then got into the writing process, which we also then managed to have almost in every thematic area, we managed to have a representative of civil society, so that all issues, even thematic areas that were being covered by Ministry of Health, we managed to second some civil society representatives. Something that is also commendable during this time was the fact that we had some consultants who were working with us. We had 2 consultants. All this time we've been trying to have a costing consultant. I'm happy that this time we had a costing consultant, because this was always an issue where, most of the writers would not have accounting background. But this time we had a costing consultant and also a consultant who was just representing civil society. I think as you will notice later on, as I also then speak of the weaknesses, the consultant this time managed to be part of the country dialogues, priority charter development, and the writing process, which was very commendable. Unlike previously, we would just have a consultant during writing process, and there would be a gap where they won't understand the process from the beginning. Then came the therapy. Then therapy and grant making, sadly, it was only the current SR who could be involved in that. The rest of civil society could not be involved. If you can move the slide. So the successes, enablers, and challenges. So CSOs managed to produce a priority charter. For us, that's a huge success. We also managed to have 2 teams this time and orientation of those teams. Also, the submission of the request was timeless, and civil society managing to secure funding, that was also critical. It was one of those issues that was a huge gap. Also having all the 12 CCM defined constituencies being represented. So developing and reviewing costing assumptions along with CSO prioritization assisted to check the need for modification of cost in the current grant. This being a continuation grant, it was very important for us to look at what was currently in the grant and what could then be included in GC7. Some of the challenges, we noticed that TB communities were not fully consulted. The organizations that are implementing TB, some of them were consulted, but the communities themselves, I think we didn't have adequate representation. I think we had 1 or 2 who were there, including my good sister Tari was part of that, but we really needed more of the TB communities. Then also allocation to TB, and then also when we did the disease split as a country, also looking at what was then awarded to community system strengthening, I think it was a bit low, and the discussions were done with the peers without the involvement of civil society. So also we didn't have a consultant who was specific for TB and malaria, making it a bit difficult in terms of now getting. We only managed to have 1 during writing, but during the country dialogues and priority citing, we didn't have a consultant specific for those areas. And also one challenge of other colleagues not not understanding global fund processes and languages. So I think this is something we can address through, continuous learning for our different constituencies. Conflict of interest, where individuals would also want to push their own programs during priority setting. CSOs being left out in certain processes such as TRP and grant making. We also had a unique situation where we had to split the teams that were writing into different venues. This posed a problem where sometimes civil society would miss some key instructions that were being issued in the main venue. If you can go to the next slide. What didn't go well and key recommendations, what can be done?
Cutting this short, Walter. You have like 1 minute to go
Thank
through.
you. So let me just quickly go through. So some of the things that didn't go well, I already mentioned the issue of communities, TB communities not fully engaged. Also, the young people not engaged in their diversity. Yes, we had some young people as part of the process, but they were not engaged in their diversity. So that would be also important. Then also making sure that all civil society, some civil society did not, participate in the midterm review of critical documents. Some recommendations. I think as civil society, we need to strengthen and continue and use the lessons that we got from this cycle, especially our coordination. We can keep it up. And also, secondly, to make sure that we treat the process not as an event, so that even now we can start, educating our communities and make sure that they know all the Global Fund processes. Also, I think we can improve our engagement of key and vulnerable populations, so that it's just not National AIDS Council engaging them, but also we're engaging them at greater length. I hope we can also improve on resource mobilization so that we don't wait for last minute. It can be a continuous process. Otherwise, thank you very much.
Thank you. Thank you so much, Walter. Another very rich submission there from Zimbabwe by Walter, and very much sort of aligned in terms of the themes of the successes, the challenges, even though each country is presenting something unique that maybe did not feature in another country, which is why this session here this afternoon is very, very important. Oh, Tariro, somebody mute Tariro. Yes, thank you. Thank you so much. So colleagues, we will take a pause here and here if we have any questions, any reflections. I'll start with Peter Owiti, because your hand went up first. And colleagues, if you just joined us, we are having this conversation, which is a webinar to share communities' experiences in the Grand Cycle 7 process. Specifically for Anglophone countries or Anglophone Africa region, that's submitted for window 1, window 2, and window 3. The objective is to hear what went well, the best practices, the successes. It's also to hear the challenges and also to hear the recommendations. And I've added 2 objectives, Glory. One is, even as we do this, let's celebrate community leadership. There is so much that is coming up in terms of community leadership, and also a lot of cross-learning that can take place. So I think it's really rich, and I appreciate that. And we see everyone in the work we are doing. So let me check if Peter Owiti is here, and other colleagues, you can use the raise hand function to give in your quick thoughts, reflections, additions, question. Or you can feel free to type your question in chat. Thank you so much, Lizzie. I see you are addressing the questions as they come and making the necessary referrals. So do we have anyone who would like to chime in to ask a question or to add? Did we lose Peter?
No, I'm here, right here.
Okay, go for it.
Thank you very much, and good afternoon, everybody, or whatever time it is in your country. I just want to add to what the presenters, all the presenters said, that in Kenya was part of the process, the Grand Cycle 7 process, right from the beginning until this point, when we are stuck at some point. And the good thing that I wanted to say is that there was there was much improvement in the level of interactions, the level of participation of the communities in all their typologies, and including the youth and the key populations and the like. And so there was vigorous participation. At some point, we did not have enough money to engage everybody, and people are engaging online. So that brought up a challenge because, the network, most of the meeting places were not designed for online meetings, and we are trying to improve, but there was a lot of people being left out in their contribution because of their online or because of their they did not have data to stay on the whole day. So this one went on well up to the grant making process. The biggest challenge we had was the issue of one is that when it came to the point of online, it is the civil society and their wider perspective that were being told, you people, we can't afford to upload you. And that means a lot of things were going on in secret that the civil society was not in light of. And therefore, you could find the discussion goes on in one meeting, everybody's there, and we are putting in the inputs. But then there is another meeting that will happen offline or in private that changes the whole scenario of the whole thing. And that again brought in different budgets. We budget on community interventions, and then later on you'll find it has changed. And then there was no sharing of the most current document. So when the country teams were coming over for review, you'd find the document that were being presented is different from the documents that we had. And that brought up a challenge. Two is that another good practice is that there was provision for communities to meet on their own and develop their priorities so that by the time they were coming to grant making, they have already agreed among themselves on what are our key priorities. We had 20 priorities in total, and that is what we were picking from. That's the basket we were picking from. And that gave us a rich field to maneuver. Because we had everybody's priority that was put. So it was only the money that was the grant split when it came, then we could only be able to accommodate from the 20 priorities to 3 priorities per module, which was very progressive.
Yeah, Peter. So you have one more? Yes, let's move to another participant for diversity.
Okay, fine. Thank you.
Steve Anguva, the hand is up, Professor. It looks like we are seeing Kenyans speaking. I want to encourage diversity. I want to see more countries, but Steve, go for it.
Yeah, thank you very much. Good morning, good afternoon, good evening, colleagues. And I'm happy I've heard from the colleagues from different countries. My quick one is I would like to appreciate Uganda, and I would like to understand how were they able to navigate through with 2 different consultants, one in country and one outside the country, and looking at maybe the consultant that was outside the country was the cost consultant. How easy was it for them to navigate through the process?
Thank you. Thank you so much. I don't see any other hands. Glory, do you see other hands? Or shall we take those 2 and transition to Lizzie?
Yeah, no other hands. Rosemary.
All right. Okay, perfect. So Kennedy, there was a question specifically for you in terms of Uganda management and working with 2 consultants. Maybe you can reflect on that. I also want to mention that in Zim, Walter, your presentation, you also highlighted the challenge around engagement, meaningful engagement of young people. And I think that's something that Ghana is excelling in. You also talked about not adequately engaging representation of TB affected communities. So I think also cross-learning can happen between Zim and Ghana in terms of specific community groups. So let's hear Uganda, if you have a reflection, Kennedy.
Yeah, thank you, members. For Uganda, how we managed to navigate the 2 was that one, UNASO is always given some little funds by the CCM to coordinate civil society every quarter. So in one of the quarters, we invited the 2 gentlemen, Chris, who came from Kenya, and Michelle, who's from Uganda. The 2 of them had different expertise in different areas. Like Chris was good in budgeting, And then Mushid was good in programming and setting the priorities very right. So we invited them in our normal meeting under CCM and to first orient them on how we do things and be able to understand. Then when we got some little funds to run this activity, we did the mapping of civil society, and we sat down with them to draw the work plan and share the experience because both of them were giving us experience in what they're doing. And we are so lucky enough that like Chris had the modules that Global Fund people use because we did actually in the country, we didn't have the latest model and the key areas. Having done a lot of consultation in different countries, Ethiopia, South Africa, and Southern Africa. So the two sat down together. We had also a Zoom meeting with the TASO. TASO is the principal recipient of Global Fund. So we brought also the TASO team with these two consultants. They had a discussion and agree on how to approach it. This was a starting point for teamwork. That's what we did with them. And that's how I saw, because the two now, TASO, the recipient, and the Mushid from Uganda, programmatic, and then the other Chris. So after meeting and with the small stakeholders representing this civil society, they sat and agreed and to go through the modules in a better way. By the time we were going for write-up, members already had their write-up done, but now it was just to lobby their content to be taken in the main write-up. That's how we played our part here. Yeah,
thank you so much, Kennedy. It's something that countries struggle with in terms of balancing the work and the expertise of consultants. So I'm happy that you are here to share that reflection. So we'll go to Sheikh and then Niluka. After those, Lizzie, you'll be on the floor, and then we go to the other three countries.
Great, thank you very much. This is where communication comes in, ladies and
so Lizzie,
yes.
just a minute. So we have two hands. We start with Sheikh and then Niluka, and then come to you, Lizzie. Apologies for that.
Yeah, no worries.
Okay, hi. Thank you. Thank you. It was good to hear the presentations. Sorry for my noisy background. My questions are mostly for Ghana. It was about the impact of the criminalization and all the noise we're hearing about new laws. So we heard from Uganda about how they managed to overcome those challenges. We've heard from South Sudan, but we didn't hear from Ghana about whether there was an impact at all of all these discussions about jailing key populations. Was there an impact? And then for Ghana, also, I would love to hear whether there are 2-3 key things you wanted to achieve. Because we heard about how you want more consultations with young people, more consultation with youth when it comes to services that they're going to receive. So that was very interesting. But so when you were going to those meetings, were there like 2-3 key things you wanted to see happened through GC7? So those were my questions. Thanks.
All right, Niluka.
Thank you, Rosemary. I think my question is more towards the end of it, but I want to raise it right now. Colleagues from the 4 countries, they've mentioned about what really worked and what were the challenges that they faced in GC7 engagement. I also saw on the chat that, like, for instance, from Eswatini, there was a colleague saying that, even in Eswatini, there are the PLHIV communities are now being sidelined in the implementation process. So it would be great towards the end of the webinar if the colleagues were presenting on the experience could sum up into 3 points, perhaps, what made their successes a reality. What were the 3 things that made their successes a reality, and that would, we all can then use that to move forward and see in our own countries how could we use some of those elements to make sure that our community engagement is strengthened. Thanks, Rosemary, over to you.
Awesome. Thank you so much, because that's part of the cross-learning that we can have. So let's first move forward, and I'll come back to Ghana for the reflections, I think, towards the end so we can hear from more colleagues, but the question is very well taken. So Lizzie, over to you.
Hi, Rosemary. I hope you can hear me.
Yes, we can.
Perfect. So this is just a breather, ladies and gentlemen. We're still doing the exercise we started with. So just on your mobile or on your laptop, just click www.menti.com or menti.com. And the next thing that will happen on your gadget is it will ask you for a code. And the code is the one on the screen. So www.menti.com. This is just a 1-minute exercise for you to catch a break. It's been intense discussions. Grab a glass of water, cold juice, because the discussions are still ongoing. So just click www.menti.com or menti.com. And the next thing you'll see, it will ask you for a code. So the code is 22736988. That's being projected on your screen. Once you're there, just a thumbs up or a clap would be good. And the questions are live, so just feel free to type and answer. Great. And the first question is, how and by whom was the community priority annex developed? Just feel free to type an answer. It could be 1, it could be 2. You're free to even give a bit of explanation on that while you're filling in the feedback. But these are also things that have come up on the conversation and will still come out during the discussions as we go on. I still have not seen any thumbs up. I'll assume people are still trying to log onto Menti. Yes, and there's a response that has come in, so that means other people are also trying to just log in. So as I mentioned, communications, we always see that when there's a lot of intense information coming in, there's a call for a breather so that we can regroup and carry on with the discussions because they're also getting heated up. So over to you. If you're having any sort of difficulties, please just ping me on the chat and I'll assist you on that, but it should be very, very straightforward. So www.menti.com or just write menti.com and there will be a pop-up window asking for a code. Yes, oh, this is great. We're getting feedback coming in. So we'll just give it a few seconds before we move into the second one. And we have, great, there's a thumbs up that has come in. That is good. So we have 6 responses, ladies and gentlemen. We have over 100 people who logged in and counting. We're at over 172. So this is just a breather before Rosemary takes over the discussions again. I think if we reach around 10 people, we can move on to the next question. But also when you've already filled in your answer, think about the next question, which is what was your experience with this new requirement? Sorry, there was a typo there, but that's how you know how interesting the conversations are. If you're having any issues, just let me know. But mentees are supposed to help you relax before we carry on with the discussions. Rosemary, you can give me a heads up how long I have before.
So it hasn't gone to the next question.
Yes, it will in a few. We're just waiting for at least 2 or 3 more people, and then we move on to the next question. Give it a sec. Thank you very much. I can tell somebody is very active. Thank you. Appreciate it. That is how we like it. 9 responses. I think we'll wait for 1 more. And this will still be online live as people are still discussing. So do not worry if I skip to the next one because I've been given a heads up. 10 responses, yes.
Yeah, and Lizzie, just to encourage colleagues to submit because this is one of the best ways to ensure there is wider participation because we don't have enough time for everybody to make their submissions, their questions, their interventions. So if we can register our reflections here, that ensures that we have really good, solid feedback.
Great. So we've got 11 responses. So I'll move on to the next one, but ladies and gentlemen, I'll keep on flipping back and forth. So as we carry on with the discussions, you'll find it live on your mobile. So that will not be an issue. Usually mentees are supposed to be like engaging and entertaining. If it was a physical meeting, I'd go, I'll be hovering around your neck, just asking whether you've done it. But 15 responses, I think we're good to go. We'll move on to the next question. So what was your experience with this new requirement? Great, there's a response that has already come in. So ladies and gentlemen, it's the same. It should just ask you for, it won't even ask you for a code. It will just take you to the next page. You should see that next page on your mobile right now, or on your laptop, or on your iPad, whichever gadget you're plugged in with.
Sorry, it's Walter. I'm assuming the experience you're talking about is the priority charter.
Good question. It's
priority.
Glory would, yeah, that's it.
Yeah, community
that's
priorities annex. Yeah.
All right.
So it's
Okay.
still a continuation of the previous question. 6 responses, let's hit 10, ladies and gentlemen. But as I mentioned, as the discussions go back to the moderator, it still will be live. So you'll have a time to, maybe some people are contemplating on the actual experience, and then you'll have a time to just fill it in. Over to you, moderator. It's still going to be live, so they can fill in. But please take note of the passcode. I'll also type it on the chat, the link and the passcode, so that we can carry on with the discussions.
All right.
Over to you, Rosemary.
Thank you so much, Lizzie. As we do that, colleagues, I want to invite you to like a 1-minute stretch. We need to stretch. We've been sitting, so feel free to either stand or to stretch from where you are seated. So I want to invite you to take a deep breath. A deep breath, guys. A deep breath. If you can take a deep breath. Are you there? Are you taking a deep breath? Are you stretching?
Yes. Yes.
Are you stretching? Please, if you can see me, you need to follow me. You need to follow me. Guys, I think I could be a PT.
Some of us are on the road crossing. Some of us are on the road.
Be careful. No accidents. So stretch, 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 stretch. You need to stretch, seriously. If you've been sitting all this time, please stretch, guys. Stretch, stretch, stretch. We don't want to hear, oh, since the Yanaso session, I've not been able to walk again. So please, stretch, stretch. All right, deep breath. Out, breathing. Out. Awesome, awesome. So I hope you feel fresher and geared up to the last mile. We are going towards the last mile now. And we want to hear from Mozambique, from Tanzania, and from the Gambia. So colleagues, if we can keep to our assigned slides and minutes, we'll be able to land this session at the agreed time. So Mozambique from Monaso. So is this going to be in Portuguese, ne? So this is when we... All right, Gilda, over to you.
Ok, muito obrigada. Em primeiro lugar, cumprimentar os colegas da região e os meus colegas do país em particular, e a oportunidade da ENASO convidar-nos para partilhar aqui as nossas experiências, sabendo que estamos dentro da comunidade da ENASO, que é uma rede anglófona, sendo um dos poucos países de expressão portuguesa, e para isso, para nós, gratifica-nos muito. Eu vou correr com a apresentação da Plazoc para poder me incidir ao mais importante, que a Plazoc é uma plataforma da sociedade civil para a saúde e direitos humanos nacional, que tem o objetivo de contribuir para o acesso aos serviços de saúde de qualidade para todos os moçambicanos. Ele está constituído por organizações da sociedade civil no geral, e organizações em particular de pessoas vivendo com HIV, de população-chave, que representam a tuberculose, a malária, e organizações baseadas na fé. Pode passar os slides, se faz favor? Já me referi no slide anterior que o tipo de organizações que fazem parte da Plazoc. Podemos passar? A Plazoc é uma rede nacional, tem uma estrutura do conselho, da mesa da Assembleia, onde estão representados outros membros, tem um conselho de direção, o qual eu presido, e um secretariado e constituências que representam, neste caso, as várias doenças, em particular o HIV, a tuberculose e malária, mas, como me referi anteriormente, as constituências de população-chave, pessoas vivendo com HIV, organizações baseadas na fé e por aí fora. Também está constituído por grupos temáticos que representam as várias doenças. Ao nível nacional, tem a sua representação ao nível do distrito, por pontos focais, distritais e ao nível provincial. Pode passar, por favor. Ok, e a Plazoc é um interlocutor válido entre o governo e a sociedade civil e faz parte também, está da representação no mecanismo de coordenação, onde tem uma boa parte da sociedade civil também lá representada, participa dos outros mecanismos como do PEPFAR e do Fundo Global, que é o foco aqui da intervenção. Também estamos representados na Troika, que são os grupos os parceiros da saúde, os Health Partner Group, que neste momento é presidido pelo Canadá, e lidera o engajamento da sociedade civil para a saúde. Pode passar? Acho que já me referi a isto de alguma forma. Podemos passar. Estamos, neste momento, a Plazoc lidera a implementação, a criação do mecanismo nacional de monitoria liderada pela comunidade e é o grande foco de implementação da Plazoc desde a subvenção passada do Fundo Global e vai continuar nisso. Indo direto àquilo que é o foco da apresentação, depois de apresentar a Plazoc, e eu vou apresentar as intervenções que são resultados da assistência técnica facilitada pela ENAS para as intervenções do GC7. Então, dizer que no país, primeiro dizer que este é um processo bastante duro, acho, para a sociedade civil, para Moçambique, em particular, acho que para o GC7 evoluímos bastante, em termos de engajamento, mas continua a ser um processo bastante duro para trazer todas as vozes e segmentos e assegurar que as prioridades da comunidade, da sociedade civil, são trazidas de forma unânime e são consideradas. Então, para aquilo que foi o processo do país, começamos com 3 workshops de engajamento ao nível das organizações da sociedade civil, workshops que foram realizados ao nível das províncias, dizer que este processo foi organizado em conjunto, o CCM e a sociedade civil. Os nossos pontos focais ao nível das províncias fizeram o papel de identificar, dentro das constituências, as organizações da sociedade civil que teriam que fazer parte ao nível das discussões provinciais e junto com aquilo que são as intervenções do próprio governo, para depois trazer essas prioridades para o nível nacional. Então, tivemos este engajamento da sociedade civil, participamos também dos workshops, grupos de trabalho, incluindo para o próprio custeamento, depois do diálogo nacional, os grupos de trabalho. Eu acho que para a experiência de Moçambique, conseguir com que toda a sociedade civil esteja representada nos grupos de trabalho, como todos sabem, a elaboração da proposta é um processo corrido. Não é até agora satisfatório a nossa participação, porque não é possível ter toda a representação ao mesmo tempo, os processos decorrem ao mesmo tempo e não tem sido fácil. Dizer que, para a nossa experiência, sentimos que é importante que a assistência técnica venha muito mais cedo. Tivemos uma experiência não muito positiva, porque tivemos alocados 2 consultores, O consultor nacional, que era suposto iniciar o trabalho com a sociedade civil, teve que sair e veio um consultor, já, vamos lá dizer, um pouco no meio do processo. O que isto exige um esforço a dobrar para a sociedade civil, que muitas vezes tem poucos meios para conseguir engajar todos os segmentos. Dizer também que não foi fácil para trabalharmos as prioridades da sociedade civil, porque Moçambique está a iniciar um processo ao nível do governo, do Ministério da Saúde, que é a nova estratégia do subsistema comunitário. E muitas vezes, para chegar a consensos de que são as intervenções da sociedade civil e as intervenções comunitárias que ficam com o Ministério da Saúde, foi preciso um diálogo muito aceso e muito árduo para nós chegarmos a um consenso e podermos também chegar ao consenso em termos de redistribuição do orçamento alocado para a própria sociedade civil. Podemos passar? E dizer que o apoio, a assistência técnica facilitada pela EANASO foi bastante importante, porque permitiu engajar a sociedade civil nos espaços de diálogo para a elaboração da proposta, o apoio ao Conselho Nacional com a liderança da PLASOC na organização e participação dos diálogos ao nível distrital, provincial e nacional, e tivemos em algum momento do custeamento, porque exigia uma expertise ou um conhecimento mais aprofundado do custeamento, foi preciso nós contratarmos uma consultoria específica para apoiar a sociedade civil, porque senão nós ficávamos atrás. E acho que para o nosso país em particular, no momento da elaboração da proposta, da divisão do orçamento e do custeamento, acho que a sociedade civil fica numa posição que, se não tem uma assistência técnica pontual, pode perder a oportunidade de colocar suas prioridades e poder conseguir o orçamento ou a subvenção da sociedade civil. Podemos passar? Já falei da realização das sessões de elaboração da proposta, incluindo o custeamento, referi-me também aos workshops, às reuniões de auscultação, priorização das atividades, incluindo todas as constituências, população-chave, pessoas vivendo e por aí fora. Como vocês podem perceber, a organização da proposta da sociedade civil inclui todos os segmentos, não é feito de forma paralela. Também foi possível a mobilização, engajamento, participação de forma virtual, porque não era possível trazer toda a gente à mesa, mas foi possível também assegurar a participação de forma virtual. Então, podemos dizer que a sociedade civil em Moçambique foi muito feliz, no sentido de que permitiu-se dar um espaço para ela liderar o engajamento da sociedade civil para o diálogo dentro da proposta do GC7. Podemos passar?
And let's be mindful of time.
Desafios do processo. Desafios do processo.
And also for Gilda, if we can go
muito ruído. Estou a ouvir muito ruído. Ok. Desafios do processo. Sentimos que a limitação na mobilização dos recursos para a sociedade civil participar é uma das razões. A contratação dos consultores no meio do processo, já me tinha referido a isso, dizer que um dos grandes desafios neste momento é assegurarmos, nós participamos em todos os processos e no grande making, o grande desafio da sociedade civil em Moçambique é assegurar que aquela subvenção alocada à sociedade civil se mantenha nela no grande making. porque a subvenção da sociedade civil é assumida dentro da alocação dos recipientes principais da sociedade civil. E neste momento, estamos em março, a sociedade civil ainda não está clara sobre uma parte do financiamento aprovado da sociedade civil. Temos clareza sobre a monitoria, mas não. E depois, já me referi a esta questão de não podermos controlar o orçamento a partir do grande making, a limitação dos recursos, a dificuldade no engajamento, por exemplo, de outras constituências, como mineiros, imigrantes, etc. E a capacidade, a limitação em termos de participação da sociedade civil no grande making, que é muito limitada. Podemos passar? Podemos passar? Ok. Boas práticas. Foi possível liderar junto do MCP o governo, a identificação das organizações. O processo permitiu melhorar o engajamento da sociedade civil. Foi preciso incrementar de forma mais robusta a participação das constituências. Podemos passar? Podemos ir às recomendações? Ok. Temos aqui 3 recomendações específicas. Gostaríamos que houvesse um apoio regular e constante para criar capacidade na sociedade civil. Estamos a falar, por exemplo, desta facilitação da IANAS para assegurar que a nossa sociedade civil se torne mais robusta, envolver a sociedade civil no processo de identificação dos consultores internacionais e nacionais. Estamos a falar da definição dos termos de referência, porque muitas vezes nós nos deparamos com situações em que não está muito clara entre a nossa necessidade e aquilo que é o escopo de trabalho do consultor. Queríamos também recomendar, em particular a ENASO, promover a realização de intercâmbios de aprendizagem e troca de experiência entre os diferentes contextos do país e local, na perspectiva de fortalecer a participação da sociedade civil na proposta do país. Vou parar por aqui, acho que estou fora do meu tempo e muito obrigada pela oportunidade.
Awesome. Thank you so much, Gilda, for that. I know we are running out of time, but we have still 2 very, very, very important presentations from Tanzania and Gambia. And so I want to negotiate a bit here with you, dear participants. If we can give time to those 2 presentations, it might mean we finish 15 minutes after the time we had planned. So that will be like 16:45 EAT. If you can show me a thumbs up, we can proceed that way. And that ensures that we give time to the 2 presentations from the Tanzania and the Gambia. So I see quite a number of thumbs up, please, colleagues. Thank you so much. So let me invite Tanzania. What will be helpful for the presentation is if you can go straight to the best practices, the challenges, and all that. All these presentations will be shared, and so we can see the background of your organization. But if we can hit to the core of the sharing, that will help. So, Marinias, over to you. Are you on?
Yes, I'm on. Marineus, this is Marineus. So there was a problem with the network.
Okay.
Do you hear me?
Yes, please go for it.
Do you hear me now?
Yes. Marinios, we can hear you.
Hear me now?
Wow. Is it an issue with muting
Do you hear me?
the original language? Yes. Can you hear me? All right. He cannot.
Can you hear me?
Yes.
Can you hear me?
We can hear you.
Yeah, so maybe it's an issue with the moving
so
from
this is Marine.
Portuguese. Awesome. Go for it.
Okay, interpretation, I think, yeah. And I'm also a system representative for Global Fund. Do you hear me?
Yes. Loud and clear. Go for it.
Okay, so I will be presenting on the how our civil society were engaged in Tanzania towards the GC7. So our best practice when all the diseases, HIV, TB, and malaria, folks, and including key population, were engaged through community consultations to gather data and evidence that could be prioritized for the GC7. So we did some meetings and consultations with the communities when we were pioneered by the non-state actors as the body that unites all civil society organizations. And we present our priority, presented at the country dialogue in Dodoma. And then the TNCM CCM sent us a request to request some folks who will be representing the civil society under the writing process. And we selected some few people who were supported by UNAIDS as well as the Global Fund itself, to the government, to the PR1, and were supported through these meetings on writing processes. And there was a combination of after the proposal was sent to Geneva, then we received TRP comments, and also through the CCM, we monitored the TRP comments to make sure that they are incorporated. Next slide. Our success and challenges. Effective use of non-state actors platform to unite the community voices was key, and this is one of our strengths because through the engagement with non-state actors, we actually monitor the priorities towards the writing process, and through the use of non-state actors, we make sure that we have representative of civil society organization towards the writing process. Priority is
All right, so Marinius, your line is breaking, is breaking. So I don't know.
Oh, I can't hear him also.
Yes, I think we've lost him, but we have the slides here. We have the slides here. So as he's trying to get back on the call, I can just go through the slide, which is around the gaps and the challenges, where one challenge is around difficulty in securing a key and vulnerable population community interventions implementer, addressed through additional consultations with KVP Forum, emphasizing the principle of nothing for us without us. And the second challenge is the removal of community priorities and the struggle of representatives to defend and follow up. And the third challenge is on balancing the state's budget preferences with community needs. So these are the challenges. He's also offering some recommendations, which number one is to continue robust community engagement for comprehensive input. The second one is to emphasize the importance of community consultations to come up with community priorities. The third one is advocate for increased community rights and gender support from the Global Fund to empower countries in mobilizing and prioritizing community inputs. And the fourth recommendation is continued country team support throughout the country dialogue, writing process, TRP comments, and incorporation and grant making process. So that's the end of his presentation. It's quite unfortunate that his line has cut. If he's back, then we can hear final reflections later. But maybe we can, in the meantime, transition to Gambia. If we have Omar, Cora, please, let's have that presentation.
Yeah, good afternoon, everyone.
Good afternoon.
Good afternoon, Lizzie, Glory, and Rosemary. How are you all doing?
Good, good, good. We saved the best for last, eh?
I know, it's most likely you do.
All right.
Okay. I would just will make it brief because since we are running out of time and there is so much some other engagements also. I will start with best practices that led to the meaningful engagement of the communities in the Gambia. First of all, I'm Omar Kora, the National Coordinator of XTB Gambia, which is a community organization of TB community organization in the country, in the Gambia. And I'll be taking you through our experience on GC7 grant funding request program. To start with, there are some good practices that, of course, for example, inclusiveness, because most of the community organizations were included during the grant funding request, and the other important thing is that the groups, the funding request teams were divided into thematic working groups, which are in which I belong to the community thematic working group, with PLHIV's representatives and the FSWs and so many other institutions or community organizations that were with us during the funding request. And that is a commendable practice, dividing the team into groups for expertism and other things.
Omar, you are on mute. Please unmute.
Sorry for that. Are you getting me now?
Yes, yes.
Please go back to the previous slides, please. I was talking about dividing the group into dividing the team into thematic working group, which was very good. And we have a community thematic working group, which comprises of different community organizations. And there was also a constituency consultation and for the different community organizations that was uploadable. And there was sharing of information and expertise from different thematic groups. For example, we might need the assistance of data experts in data, and they will provide it for us to our thematic group. So we were sort of like sharing information and expertise from one thematic group to another, which was really uploadable. And to begin with, we initially start with community consultation and dialogues, and we were even expecting some short fund from NRSO for community dialogues, but later on it doesn't materialize according to the CCM. And but despite the fact there was a dialogue, but limited to Western 1 and 2 due to lack of resources. Please move on to the next one. Okay, we face some challenges though, and some of the challenges are limited participation of communities. I've said earlier, communities were represented, but some communities were represented more than some communities. For example, the community that I represent, it is only one person from the TB community, which was part of the whole grant funding request process to the end. So it was only one individual, which I happened to be that person. And I was feeling that it would be better if we have more participants from the TB communities and other communities to be part of the process. And the FSWs also have only one representative, and refugee institution responsible for the refugees in the Gambia also have only one representative. So I was hoping that these are some challenges which we need to look at, and probably the next funding request we could at least add the participation of this community organization into the funding request. And the other item is there was inadequate constituency consultation. There was a constituency consultation, obviously, but to us it is not very adequate. It is not adequate because it was limited to only Western 1 and 2 for TB, obviously, for TB community. It was only limited to Western 1 and 2, and but the CCM said there was issue with funding. There was not enough funding to incorporate all the TB community organizations in the constituency consultation. And we also have a community. The other challenge we have in the Gambia is that the community thematic group was led by a government institution, which is the primary health care, and it's very difficult to avoid conflict of interest in that case because we are from the community, and they do. The primary health care is responsible for community health workers and village health workers and others, which play a very important role within the communities. But it would have been better if the community thematic group for the funding request is actually led by the community organization from the 3 disease area, and the biggest challenge we have in our country when it comes to the funding request is excluding most of the community priorities from the funding request. We developed the priorities as a group, as a community group, in reference with the modular frameworks and other documents from the Global Fund to guide us through it. And we develop our priorities, and from all the institutions have an input in that priorities. All the community institutions have inputs in that priority. But at the end of the day, most of the priorities were dropped, and which was very unfortunate. That's a very big challenge. Please move on. Okay, here we have some key recommendations. To start with the recommendations, community constituency consultations should be far-reaching and inclusive. It should not concentrate, like in our case, it is only for Western 1 and 2, and we have 6 to 7 regions in the country. So we feel that it should go beyond Western 1 and 2. Consultations should go all throughout the whole country, in all the regions in the country, to make sure that everybody is included in everybody's voice or priorities are captured and included. And the next item is community thematic group, working group, like I said earlier, should be led by a community organization from the 3 disease area to avoid some form of conflict, because if it is led by a government institution, which is funded by government, so at the end of the day, there might be an issue, to call it short. And the next one is community priorities should be incorporated. As mentioned it earlier in our challenges, most of our priorities were dropped, and I could see at the end of the day, I could see the priorities from PLHIVs only were captured. So our priorities were mostly dropped and other communities. And finally, it has been said in different platforms. I've been saying it in different platforms and different conferences and gatherings. Global Fund need to establish a clear-cut percentage for community groups, because communities face lots of challenges in getting most of their priorities through and getting them into the grant and approved. So the biggest headache is getting most of their priorities into the grant. That's the biggest headache, because mostly for us, our work stopped at community thematic working group when we forwarded our priorities. Then it goes. So where it is dropped or removed, we don't even know. So at the end of the day, the final document doesn't capture our priorities. We flag it on a number of occasions, and it still remains like that. So I would strongly recommend that Global Fund try to establish a clear-cut percentage from the grant for communities, uniquely for communities under the 3 disease area. in that case, it will solve this problem of our priorities are dropped or our priorities are not captured or descended. But in this case, the communities will know and understand that this is a percentage they have, and work on their priorities to suit that percentage of the grant, so that it will be evenly shared within the communities according to their priorities, and everybody will sing kumbaya, and that will be the end. Thank you very much, and I hope you like it. It is brief, and thank you very much once again.
Thank you so much, Omar. It's interesting because through your presentation, we encounter a unique challenge, that one of having the community thematic working group being led by a government agency. So I think we can see the diversity of challenges. I want to take us to a participation where we can all participate in the recommendations from communities. And now Lizzie already has something in the chat. Maybe Lizzie, I hand it over to you so that everybody can have a chance to participate, to input before we go into the closing.
Perfect. Thank you, Rosemary. And we still have over 130 people on the call. So this is amazing news. It's another time for the Mentimeter experience. And as I mentioned, this is just for you to catch your breath before we continue with the discussion, but we're almost at the end. So I hope you'll stay a bit strong. Now, this is the last question, and it's the one that's very important. Next, please. Oh, sorry. That's the one. So we're looking at recommendation. And as Rosemary mentioned, it's unfortunate that we couldn't hear from all the 180 participants, but this is one of the ways that we capture all your contributions. So the question is, what would be your recommendations for future funding request engagements? And as usual, www.menti.com, and that's the passcode 38419892. Feel free to just answer your questions, and I'll leave this open until the end of the discussion. So Rosemary, I've typed it on the WhatsApp, on the chats, and given all the information. The link is there. Just click on it. It will take you to the page, ask for the code, and you can submit your answers. And I'm also looking at the live feedback, just to also keep tabs on who has given feedback, etc. And it's anonymous, so you can say any sort of recommendation which we're going to put forth and share with GF on what everybody, most of the participants start during the whole GC7 experience webinar that was hosted by INASO. So we have 2 responses in. We'll just hold it a bit. www.menti.com, or just write menti.com. It will give you a pop-up screen, and there's key in the codes that you're seeing in front of you, 38419892, and just give your honest recommendation. What I like with Mentimeter is the anonymity. We will not know who wrote what, so you can give your honest feedback on what you would recommend as far as the GC7 process is concerned. And as we mentioned, this is experience sharing, so you might have those insights that other countries are waiting for. So yeah, Rosemary, that's it. We leave this screen, I think, being projected, the slide itself, and we can carry on with the discussions because I know all presentations are done.
Awesome. So what I'll do is that I have typed a question in the chat. This is for all the panelists because we don't have time to go around all panelists. But if you can just drop a one line as we go into the closing remarks, a one line, Kennedy from Uganda, that tells us in one line what made your success a reality. And I think there are many things that made your success a reality. Pick just one thing that you'd like to share with us as your final reflections. So the same with Ghana. For Ghana, there's a specific question that a colleague posed to you in terms of when you went into this process, what did you want to see or to achieve? Please kindly utilize the chat from Ghana, the response from Ghana. So you respond to that one kindly. Peter Garang from South Sudan, you told us in the presentation that you were able to secure $4 million for human rights, HIV prevention, for KVP, community interventions, under care and treatment. Please tell us what made this success a reality in one line. We have Zimbabwe. Walter, thank you so much. What made you achieved certain milestones and achievements in one line? What would you like to tell us in terms of what made your success a reality? And we have the same for, who was the next person? From there, we went to Mozambique. A lot of lessons there, again, in terms of civil society participation, contribution, but challenges like financial resources, limited capacity. Please type for us one line there. And then Tanzania, we also had your presentation. If you have any final reflections, the IANASO team will compile this and it will be part of the report. And also, Omar, even though we hear your unique challenges, what is one thing that you can say you were successful in and what made that success a reality? Kindly, I encourage all the panelists to drop a one line of your final comments. I'm doing that just so we can also be able to meet the time we negotiated for. And my summary is going to be very quick because we have sort of summarized this conversation. We were looking at Anglophone Africa region, countries that submitted in window 1, window 2, window 3, and we were looking at best practices, the challenges, and the recommendations going forward. And as we were doing that, we were also celebrating community leadership, just applauding the heavy lifting that communities have had to do in Grand Cycle 7, and also cross-learning, a lot of learning from colleagues. And, you know, we've had a broad, you know, diverse reflections, you know, from the fact that there was pre-caucus dialogues, you know, communities coming together to have consultations. We've heard that there were concerted efforts, you know, communities even collaborating with the non-state actors in order to coordinate the community and civil society voice at the country level. We have heard about how communities were unified, how strategic partnerships, you know, with the technical partners, with the Global Fund CRG, with IANASO in terms of the technical assistance that IANASO provides. What was interesting from Kennedy, you also said resilience and determination. Love it, love it. Resilience and determination, which is an indication that the process is not easy. It's not without its barriers, but resilience and determination helps us to navigate those challenges. There was also a mention that we also need structural reforms, you know, institutional barriers within the country coordinating mechanisms. It's something that was mentioned by a number of countries. So those institutional reforms were also flagged. There were a number of countries that said, look, we need stronger youth leadership when it comes to these processes. While another country was saying, look, this is the youth leadership, and we have gained a lot in the Grand Cycle 7 in terms of youth leadership. And I think there's a lot we can learn there. We're also hearing a lot of, you know, national strategic plans, you know, participation in the review, making sure that our priorities are included in there, looking at the gaps. But I also had a lot of, I would say, diversity. Most of the countries presented the fact that there was diversity in how civil society, in how communities, especially communities, this is a community experience conversation. You know, there was that diversity, KPs in all their diversity. But in other countries, we are hearing that that diversity wasn't necessarily experienced. And so I think that's a good reflection to think about how do we correct that? How do we course correct that? There is a question around how much representation is enough. A lot of countries are saying, look, we only had one person, you know, sit in the writing. One TB affected community, you know, we had a great representation in the HIV process, not so great in TB and malaria. So I think also appreciating that that's also a challenge that is coming out. There was a lot. And for me, the last one, because this one has been a chronic challenge, where community priorities are excluded from the funding request. So it's a chronic challenge. We have to keep pushing. We have to find ways, avenues, and tools to make sure that we overcome this. Is it through strategic partnerships? Is it through consultants who can be there from the beginning to the end? I don't know how we can babysit this process because sometimes we go home scratching our head. Because you know, when you come tomorrow morning, everything you worked on yesterday is missing, you know. So I want to thank you very much for the reflections. We ate into time, but still time was not enough. I think this is a very important conversation, and I think we need to keep going. And I think the IANASO team in the chat have already told us, you know, what's coming up next. I think it's here in the chat from Lizzie, and I know colleagues from the Global Fund are having to jump off. And so I think kindly follow the chat very closely. There are some announcements they are going on. The teams, the panelists have mentioned their key points, but they will also be included in the report, so you are not missing anything. So at this point, I want to call upon, I want to see if Aunt Cecilia is on the call. We want 2 people for the closing, a representative from the Global Fund. So Niluka kindly, and Aunt Cecilia from Ghana, if you are here, kindly to give us your final reflections. And Lizzie, maybe something about the Mentimeter. Did you get sufficient feedback that is useful in terms of helping us to learn and to share recommendations with the Global Fund, with the country teams? Are we good on that end? All right, so if Cecilia is not here, let's start with Niluka, and then IANASO can also help, or we can have a community representative to volunteer themselves for the closing. Over to you, Niluka.
Thanks, Rosemary. And thank you so much, IANASO, for organizing such a fabulous webinar. The participation of community partners is phenomenal. And that shows how much we as communities want to talk about our engagement in the GC7 process, but more importantly, how do we want to use the best practices that we have. Sorry, just give me a minute. It asks for my speaking language. Okay. How much we want to use these lessons learned in the GC7 implementation cycle, as well as the GC7-8, which will be coming up soon. What I've heard a lot of best practices from our colleagues who presented in their country experience, and a few points really caught my attention. The first one is how much our colleagues insisted on engaging and networking with community and civil society representatives across a particular disease, but also across the 3 diseases. I've also realized how different partnerships were built around the GC7 process, with Stop TB partnership with UNICEF in certain countries, IANASO coming in as a technical service provider or a facilitator in getting technical assistance, and how these different partnerships brought so much strength into community engagement during GC7 process in terms of technical support, but also in terms of, more importantly, the financial support that was required. Before joining the Global Fund, I had the chance to be engaged in the Sri Lanka country dialogue process for the last year and the first month of this year. And something that really made a difference in our engagement in Sri Lanka is how these small grants really help us to pull communities together to engage more actively and effectively in the country dialogue process. I know as communities, we talk a lot and we advocate a lot for allocations for communities, but I think, you know, because of the difficulties that we've been facing in accessing resources, financial resources, we have adapted ourselves to stretch as much as possible the small resources we have. And across the world, we see how much this is impacting our work in terms of getting involved meaningfully in the country dialogue process. Finally, I just wanted to say that we saw on the chat that some of our colleagues from countries in the same region expressing their views about how their engagement has not been as effective as the experience of colleagues who presented. So the Anglophone Africa Learning Hub, Waki Health, and all the other partners here now, so everybody here is a great platform for us to share these learnings and really support our country partners in other countries to, use that experience and make their engagement more meaningful at the country level. So with that note, once again, as the Global Fund, we really thank all the participants today and all the speakers for sharing their experiences, and UNASO for organizing this call. Thanks, Rosemary, and over to you.
Thank you so much, Niluka. Our regards and appreciation to the Global Fund. Could I have someone from the community groups, any community group, any country, to do some quick final reflections? Kindly step in, anyone. Moment of leadership. Yeah, all right. I'll go to the participants list and just pick someone. All right. So,
Thank you. I'm Flavia.
Awesome. Well
Hello.
done. Go for it. Go for it.
Thank
Oh, Flavia, your line is not good. Your line is not good.
I'm Flavia from Uganda, but
oh, your line
Hello,
is not.
Rosemary.
Okay, have an
Let me help further because I had the same problem when presenting. So I would like to thank you very much for organizing this. And actually, what communities we want for you to put forward continued support through IANASO. We have been supported very much. IANASO has been very supportive, including mobilizing countries to apply for CRG, community rights and gender, and providing technical assistance. For instance, at the time of those community annexes, they are the one who taught us how the annexes should be written and how they should be sent and who should send the annex. So I think that should continue. That's very important and key for the community actually to make sure that the priorities are being coded within the writing. And actually the support should be throughout because most times, for instance, in grant making, it's where the priorities are being removed. So backup team should be there to support always the writing team so that to make sure that the priorities remain till the last submission of the Global Fund. Thank you very much.
Thank you so much and happy to have you back. So colleagues from Team IANASO, all the presentations and the recording will be shared. We want to appreciate you all. We thank you, the leadership of IANASO, Tumaini, the team there, Glory, Lizzie, and all the team at IANASO for convening us, to the Global Fund and all the technical partners that are supporting this work at country level. We truly appreciate that, and we look forward to our continued collaboration. We thank you very much, and this brings us to the close of this session. Asanteni sana.
Right. I was wondering whether
Thank
people...
Thank you so much, Rosie. And all
Thank
who
you very much,
participated.
all the visitors.
Thank you.
We can have
And
a group
greet you.
photo.
Tumani, Mambo,
Photo.
a good photo.
Group photo. All right, guys.
Yay.
Okay.
You just crop us and paste.
Liz, take a group photo. I am.
All right.
Okay,
And
okay.
Niluka,
I'm on
you had
standby.
something?
Yes.
Niluka, you had something.
Squeeze.
Yes, you look very bright, like community.
Say
You know, like you're really.
squeeze.
Yes. I'll go to the next. Just one more. Just trying to make sure I capture everyone. Please have your video on just for a split second. Yep, I think that's the last one. Good. We're good. I know we're losing people, but all good. I can see one more. I've seen Omar. Omar, you were very clear. I liked that angle. Yes, just one more. Great.
Lizzie and Shwab in the photo.
Is it okay, Lizzie?
It's more than okay. I like the fact that people are coming on now.
Okay,
So all good.
okay.
Please feel free to drop off.
Okay, asante everybody. Me, I have to go.
Thank you.
Okay. Thanks, everyone.
Thank you.
Thank you,
Bye.
Thank you, everyone. Bye-bye.
Bye. Bye.